Today is a very special day. It's International Nurses Day, the 12th of May 2020. I've been a nurse since 1993 and I still remember the time when I started my career at the University of Pretoria. Didn't know anything, just knew that I wanted to help people and wanted to see if nursing could lead me there. My name is Liezl Naude. I'm a wound care specialist in Pretoria at Eloquent Health and Wellness. One might ask, why am I doing wound care? Well, I think it's chosen me, not the other way around. Ever since I can remember, I've done wounds. It's been part of my life, it's been a passion of mine, it's been something that's just been who I am, and I can't think about anything else that I would love to do more. Another passion of mine is education and empowering others and enhancing knowledge and skills. You might ask, why would I do an interview with a mask on? Well, I'm a nurse first of all, and COVID-19 has changed the image of nurses forever. When I think of a nurse, or when I look at social media, the image that we see is this: a person wearing surgical scrubs and a surgical mask. You can't see their smile, you can only see their eyes. But I do believe the eyes are the windows of the soul, and you can see so many things when you just make eye contact with someone. This has become the face of nursing globally, and since this is the International Year of the Nurse, this is also my way of saying I'm proud to be a nurse and proud to be a leader in my field. I love what I do. I'm a wound care practitioner in the east of Pretoria, and we focus a lot on diabetic ulcers, chronic wounds and hard to heal wounds. It's not easy. It's not easy being a nurse, and it's certainly not always easy to deal with complicated wounds. It keeps you humble. Just when you think you know everything about wound care, you'll get a patient coming in with a wound that you feel that you're not moving forward, you're not getting it right, and you doubt your own abilities. But I can say to you one thing. If you believe in yourself, if you trust your gut, and trust your education and the knowledge and skills that you've been taught, you can make a difference. Always put your patient first, but remember, if you are not well, you can't treat your patient. There's been a lot of questions about our protective gear. Is it available here in South Africa? How are we going to cope really when everything happens? Because we're in a waiting period at the moment. We are ready, but we don't really know for what. And we can only hope that the numbers will not rise. I would like to ask you, are you ready? And I've seen in the last week or so, since we've gone to level 4 lockdown, everybody is sort of saying, it's enough. We want to be able to go on with our normal daily lives. It's fine to say so. We're all fed up. I'm fed up. But what if? Our government has asked us for minimal things that we need to do: keep our social distances, wear masks. A mask is not there to say that you can't get COVID-19, but it's certainly there to minimize your risk and also just to safeguard the patient or person next to you. In our practice, mask is part of our daily routine. I'm a wound care practitioner. I'm supposed to look at infection control. I'm supposed to prevent infection from spreading to one patient to the other. Have we changed our practice much in COVID-19? Not really. We still wear masks, we still wash our hands, we still use hand sanitizer, we wear protective gear, aprons, and we also use linen savers in between patients. We wipe the beds off, we make sure that there is no contact. Those are the things that we do. What's different is that we do monitor the patient's temperatures when they come into the practice. That's changed. And we ask them questions about COVID-19. Has it changed who we are and what we do? No. I'm a nurse and I will stay a nurse. I remember as a young student nurse, if somebody asked me, what do you do? I would say I'm a nurse. But I would say I'm not a normal nurse. And I believe there's no such thing as a normal nurse. We are all extraordinary. And we impact patients' lives and families' lives differently, every one of us. You can make a difference no matter what you do. And nursing is not only defined by one thing. A nurse can be anything. I'm not an ICU nurse, so I'm not on the front line in ICU. If you put me in ICU, the patient would probably be worse off than what they are currently. I don't know about the machines, I don't know the protocols. My field is wound care, and I'm going to try the best that I can and be the best in my field. And that's the same for other nurses. There are so many things that you can do in nursing. You can do midwifery, you can look at kids, you can work with psychologists, you can do so many things in nursing. It's great that the world starts to realize what we are capable of as nurses. And I want to challenge my fellow nurses and say, what are you capable of? What can you do, and how can you make a difference? COVID-19 is not going to define who we are, but it gives us an opportunity to show the world what we are made of. Nurses, doctors, everyone working together are superheroes. It's time that we show it and that we make people aware of that. But a superhero is not only the ICU nurse, it's every one of us dealing with patient care. From the person giving out the medication, till even the care worker or the assistant that's cleaning the floor after a procedure. From my side, I would like to say Happy Nurses Day, everyone. 12 May 2020 will forever be remembered. It's a day that we will never forget. In South Africa, the face of nursing is changing rapidly. There's a lot of new plans from the South African Nursing Council, and I'm looking forward to that. I'm looking forward to look up to our leaders from the Forum for Professional Nurse Leaders, the Society of Private Nurse Practitioners, and so many others, even the Wound Healing Association of Southern Africa, where a lot of nurses are actively involved. You need to decide for yourself, how are you going to make a difference? Not only now, during this international pandemic, but in future. Be the best you can be. Be the nurse you are. Thank you for listening to me, and may it be a great Nurses Day 2020.